My name is Leslie Canham, and today the topic is OSHA Bloodborne Pathogen Training. See, our objectives with this course today are to meet your annual bloodborne pathogen training requirements, to make sure that we can identify hazards in a dental office, and so you can manage an exposure incident. You see, every single dentist is at risk every single day of being investigated or shut down for not following regulations such as OSHA. So we want to make certain that we have the steps in hand to respond to an exposure incident, to respond to an OSHA investigation, and simply to keep our practice and our team safe. But why does OSHA require annual bloodborne pathogen training? Well, the bottom line is that just like CPR training, you'll know the steps to take step by step by step in the event that you have an accident or an injury. You'll know what to do to prevent accidents and injuries, such as the proper personal protective equipment to wear and work practice controls to reduce the risk of any kind of accident. So training, while it's required annually, helps us to increase confidence, to reduce errors, and to create a culture of safety and prevention that team members most certainly appreciate and deserve. OSHA does cite dental offices when they are not in compliance. If you had an OSHA citation, it could be quite costly. In a 12-month period, OSHA fined dental practices over $110,000 for violations. Most of the violations were in the category of bloodborne pathogens, and there were a few in the category of hazard communication. In this webinar, we'll focus on the bloodborne pathogens. The costly citations have actually increased over the last years. OSHA got a raise. Used to be that they could only charge a maximum of $7,000 for a serious violation or other than serious violation. Now they can charge $12,471 for such a violation. Used to be they could only charge $70,000 per violation for a willful or repeated violation. Now they can charge over $124,000 for such a violation. One dentist in Illinois was fined $53,900. One dentist. He had 2 locations. What did he do so terribly wrong to be assessed fines in excess of $50,000? Well, the violations were, first, he did not establish bloodborne pathogen training for his team or an exposure control plan. He did not establish a hazard communication plan to train his team on how to deal with the chemicals found in a dental practice. He failed to require the use of appropriate personal protective equipment. And he did not provide a medical evaluation for individuals who were exposed to blood or body fluid as a result of an accident. He didn't train his workers on bloodborne pathogen hazards and precautions. So today we're going to go over the basics of a bloodborne pathogen standard for dentistry. First, you'll need to determine what state requirements you have based on the OSHA program in your state. Many states fall under Federal OSHA and therefore follow the Federal Bloodborne Pathogen Program. Some states have their own state plans. If you're in such a state that has its own state OSHA plan, you'll need to look at the OSHA website or contact OSHA directly to find out if they have a specific bloodborne pathogen standard for your state or whether they follow the federal standard. So the question to ask yourself before you begin everything is whether you've even got an established OSHA program in your office. Have you got an OSHA manual? Have you conducted OSHA training within the last 12 months? Do you provide appropriate protective equipment? And do employees wear the proper PPE for the task? Have you conducted a needle stick safety evaluation, evaluating the safer sharps that are available in the way of syringes or in scalpels or even needle recapping devices? Have you discussed the various ways that you can make recapping syringes or working with sharps or sharps containers safely? Have you documented this training? So, let's take a look at the proper steps to conduct OSHA bloodborne pathogen training. And you can either check off the items that you're already doing or add the items you're not doing to your to-do list to fill in the gaps. Step number 1, provide OSHA training to all employees, especially employees who join your practice, and offer the hepatitis B vaccination to all new employees within 10 days of employment. Now, the annual bloodborne pathogen training, as the word states annual, needs to be repeated every 12 months. So it's provided for all new employees and then repeated every 12 months for all clinical team members. It's provided at no charge to the employee during regular working hours. So this means the training is conducted while the employee is on the clock, being paid for the time that they receive the training. And this training must be conducted before an employee is placed at risk. So the training happens when a team member joins your practice and anytime there are changes to protocols or procedures that might jeopardize employee safety, and at least annually. During your OSHA training, it's a good idea to have written safety plans. Your OSHA manual is a compilation of safety plans that are already written out for you. However, they need to be personalized to reflect the procedures and policies in your office. No matter how good your OSHA manual is, it doesn't describe the location of your first aid kit or fire extinguisher or eye wash station. It doesn't describe who in your practice to contact in the event someone becomes injured. And it doesn't provide the name and address of the healthcare provider or facility who will receive an employee following an injury. That's where you'll need to personalize the written safety plans. Another part of your bloodborne pathogen training, in addition to having written plans or an OSHA manual, is to provide a copy and explanation of the bloodborne pathogen standard. You can get a copy of the standard from your OSHA manual. You can also download a copy from the OSHA website. And again, be sure and check with your state to make sure that you have the proper bloodborne pathogen standard. If your state follows the federal standard, you can download your copy of the bloodborne pathogen standard from the Federal OSHA website. All you have to do is go to www.osha.gov. Another very helpful part of the OSHA website are the safety and health topics specifically for dentistry. In the search bar of the OSHA website, type the word dentistry and then search. The Safety and Health Topics page also has links to various different websites to provide you with resources to set up your safety program, as well as provide references for information you might need when you conduct your team training. One of the most important parts of your team training is your exposure incident protocol. Your exposure incident protocol covers procedures and policies of exactly what to do, step by step by step, in the event that you have an accident or an exposure involving blood or body fluid. It's just like CPR. You know what to do step by step by step. And bloodborne pathogen training conducted annually will give you the same top-of-mind access to the step-by-step protocol of what you do, from first aid to reporting the incident, to asking the patient the hard questions, to accessing health care, to follow-up, to documentation. Another part of your OSHA training is to make sure your team is well versed on infection control and prevention measures. infection control training provides the basic foundation for preventing contact with infectious agents that could cause infection transmission, not only to employees, but to patients. We also want to make certain that before we conduct our training, that we have prepared in advance a location where employees will go for medical evaluation. Rapid access to a healthcare provider is required by OSHA. So I always recommend that you have a map with turn-by-turn directions, the name of the facility, the phone number of the facility, and the hours that the healthcare provider facility is open, available during your training. Let's say that I come to work for your office on Monday morning as your new dental assistant. The first thing that you're going to need to do is provide me with some paperwork to fill out. There's various tax forms that I need to provide for employment, but there's also paperwork that OSHA requires me to fill out. One is called a medical record keeping form, and the other is an offer of the hepatitis B vaccination. If I am not interested in receiving the hepatitis B vaccination from the employer, I need to sign a declination form that shows that the vaccination was offered and was declined. Now, the medical record keeping form that I fill out for you, you can locate that in your OSHA manual, as well as the documentation on what statement I need to sign in the event that I decline the hepatitis B vaccination. If I accept the vaccination, then you'll need to have a healthcare provider available for me to go to in order to get my vaccination series. The medical record keeping form is such an important form that OSHA requires employers to maintain that document, duration of employment plus 30 years. It's also the form that would maintain documentation of any exposure incident or accident that I have while I'm in your employment. Now, let's say that I've been vaccinated for hepatitis B. It would be a good idea to have me sign the declination form because OSHA doesn't give much room on the medical record keeping form for you to indicate that I've already received my vaccination elsewhere. Only a place for you to document that I received my vaccination while I was in your employment. If I was vaccinated elsewhere, I would still sign the declination form. It means that you offered me the vaccination series and I declined it. Another option would be to bring in my documentation of being vaccinated or my documentation of immunity. And remember, any of this information is maintained with my medical record keeping form, and it's maintained by the employer, duration of employment plus 30 years. You see, dental workers are at risk for exposure to blood and body fluid and bloodborne pathogens. And the risk is exposure to human immunodeficiency virus, hepatitis C, and hepatitis B. Hepatitis B is currently the only vaccine-preventable bloodborne pathogen disease, and OSHA requires employers to offer the hepatitis B vaccination to all new employees within 10 days of employment. There is no vaccination for hepatitis C, and there's certainly no vaccination at this moment in time for HIV. The hepatitis B vaccination series is offered in 3 doses. The first dose, let's say, would be offered today, the second dose in 1 month from now, and the final dose is delivered at 6 months. The most important part of the hepatitis B vaccination series is not the 3 vaccinations themselves. It's the blood test that's conducted 4 to 6 weeks after the vaccination series to determine whether the vaccination worked. So let's review. OSHA requires employers to offer the hepatitis B vaccination to all clinical employees at no charge within 10 days of employment. In addition to offering the vaccination series, dentists are required to pay for the post-vaccination testing to make sure that the hepatitis B vaccination worked. In other words, the individual has acquired immunity with the hepatitis B surface antibody present in a positive high titer. If the vaccination series doesn't work, the employer is obligated to provide the series a second time. The numbers show that individuals who did not achieve immunity the first go-round of 3 doses of vaccination, 50% of individuals that go through the series a second time will achieve immunity. If there are questions about the hepatitis B vaccination, you can go to the CDC website and find a wealth of information surrounding frequently asked questions. Simply go to www.cdc.gov and type in hepatitis B in the search window. There's a number of landing pages, but the page that would be most helpful would be Hepatitis B Vaccination for Healthcare Providers. The next thing that OSHA requires dental practices to do is to provide information to employees on how to recognize the signs and symptoms of hepatitis and HIV. Now, it's not so employees can diagnose hepatitis or HIV in a patient. The reason for training on recognition of signs or symptoms are if an individual became infected with hepatitis or HIV as a result of their occupational duties, they might recognize some of the signs and symptoms in their own body. So for hepatitis B and C, there are similar symptoms. They include fever, fatigue, dark urine, nausea, vomiting, abdominal pain, loss of appetite, clay or beige-colored stools, joint pain, jaundice, which is yellowing of the skin or the whites of the eyes, or perhaps rapid weight loss. Some individuals experience symptoms and some don't. As a matter of fact, 30% of people who have hepatitis B virus infection have no symptoms. Centers for Disease Control made an announcement in 2012 that all baby boomers, that's people born between 1945 and 1965, get tested for hepatitis C. They indicated that 1 in 30 baby boomers has hepatitis C and doesn't know it. That means if all baby boomers in the United States got tested for hepatitis C, it would reveal more than 800,000 new cases of hepatitis C in the United States alone. Baby boomers are 5 times more likely to be infected with hepatitis C than the rest of the population. Now, the reason baby boomers are more likely to be infected than the rest of the population is not completely understood. But according to CDC, the rates of hepatitis C were highest in the 70s and 80s, where baby boomers may have been exposed to it. And because 80% of people have no symptoms when they are infected with hepatitis C, they may not realize that they're sick. And if they don't perceive themselves to be sick, they may not ever have been tested or diagnosed with the virus. Another great reason for being tested or screened for hepatitis C is that now there are treatment modalities that can cure hepatitis C. In the past, there was no cure, but now there is a cure for a potentially life-threatening disease. On the CDC website, if you type in hepatitis C, you can get a wealth of information that explains the effects of the hepatitis B and hepatitis C on the human body, and also explains the information about hepatitis C and the testing and recommendations for treatment. The final bloodborne pathogen to discuss today is human immunodeficiency virus, HIV. OSHA wants us to recognize signs and symptoms of HIV, again, in the event that we're infected, so we could recognize those signs and symptoms if we experience them ourselves. However, HIV does not always have symptoms. Sometimes people who are infected with HIV don't have any symptoms at all for many, many years. And the symptoms that may occur might occur within 90 days of initial infection, or again, not at all for many, many years. Those symptoms would include possibly a headache, sore throat, rash, fever, diarrhea, rapid weight loss, swollen lymph glands or nodes, and cough or shortness of breath. And again, remember, symptoms might not occur at all. OSHA also wants dental professionals to be acquainted with the modes of transmission of bloodborne pathogens in a dental setting. There are two modes of transmission. One, percutaneously, that means through the barrier of the skin. That can happen from a puncture with a sharp contaminated instrument or splashes or sprays of blood or body fluid to the skin of the healthcare provider. Non-intact skin or opening or cracks on the skin can provide portals of entry. Also, patients might unintentionally bite us and break the barrier of our skin. The other way we could be exposed to blood or body fluid is permucosally. That means through the mucous membranes. So the eyes, nose, and mouth are the portals of entry for permucosal exposures. Fortunately, we can protect our eyes, our nose, and our mouth rather efficiently with proper eyewear and a surgical face mask. The next step in OSHA requirements is to conduct your exposure control training and to review your exposure control plan. What do I do to prevent exposure to blood or body fluid, and what specific steps do I take to prevent infection transmission in the event that I have an exposure incident? So first, let's determine who's protected by the bloodborne pathogen standard. Dentist, hygienist, dental assistants, sterilization assistants, lab techs, or anyone who works in the front office of a dental practice who occasionally helps in the clinical area, whether they expose radiographs or images, or clear a treatment room, or process contaminated instruments. All of these individuals are exposed to infectious agents and are afforded the protection of the bloodborne pathogen standard. So they must be provided the training annually. Let's talk about exposure incidents. Exposure incidents are preventable. First of all, blood or body fluid exposure can easily be prevented by wearing the proper personal protective equipment. If you're wearing protective eyewear and a surgical face mask, you're protecting the mucous membranes. If we're wearing a clinical jacket and gloves, we're protecting those areas of our skin from exposure to blood or body fluid. Sharps injuries, on the other hand, are not as easily avoided. Sometimes accidents just happen. Even if we're wearing all the required personal protective equipment and we're working safely, there are other variables. The patient might move unexpectedly, or a device might fail, or when there's two operators, there may be a lapse in vision as to where a sharp instrument is headed, thereby poking the other operator. I'd like to review the exposure incident protocol with you step by step by step, so we know exactly what to do in the event of an exposure incident. And this is part of the training that should be discussed annually. The steps from first aid, to reporting the incident to employer or supervisor, to evaluating the risk of the exposure, to medical evaluation, to the documentation that OSHA requires us to have, to the follow-up. All the steps must be in place in order to prevent infection transmission, expedite medical care to the exposed employee, and to follow OSHA's requirements for documentation. So the most important part of your exposure plan is to have an emergency action plan where everyone knows what to do step by step by step. And again, if you can provide this information to your team members and review it more frequently than once a year, it will be top of mind in the event that the unthinkable happens. So let's build up the scenario. You're working on a patient, and your dental assistant accidentally gets poked with an instrument. The first thing that needs to happen is first aid to the exposure site. So the dental assistant will need to go wash the wound with soap and water. If the exposure occurs to the eyes, nose, or mouth as a result of a splash of blood or body fluid, then the eye wash station is utilized to flush those mucous membranes. The next step would be to inform someone, the employer or supervisor, that an exposure incident occurred. Now, if the assistant is working with the dentist in the treatment room, it would be obvious that there was an exposure incident. The assistant would probably have said, ouch, or may have had to tell the dentist, I just got stuck with a sharp contaminated instrument. We want to make certain that we don't use the instrument that was involved in the accident on the patient. So it would be a good idea for the assistant to remove that instrument from the treatment tray so the doctor doesn't inadvertently reach over, grab the instrument, and use it on the patient. Because now it likely has blood or body fluid from the assistant. And it wouldn't be fair to the patient to expose the patient to the blood or body fluid of another person. The next thing that we want to make certain that we do is determine the risk associated with the exposure. Let's say that the instrument was a clean instrument. It wasn't used on the patient. It didn't commingle with other instruments that were used on the patient. We don't have an exposure incident under those circumstances. Yes, we have an injury, so first aid is warranted, but we wouldn't have to go through the rest of the steps. If, on the other hand, the instrument did have blood or body fluid from the patient, or you think it might have blood or body fluid from the patient, or it commingled with other instruments that had blood or body fluid from the patient, then we need to consider this event an exposure incident, and we need to initiate our emergency action plan so we can prevent infection transmission and expedite first aid to the exposed employee, as well as following all of OSHA's bloodborne pathogen standard regulations surrounding an exposure incident. If the instrument was contaminated, there will need to be some documentation as to what was on the instrument: blood, tissue, visibly bloody fluid, or other potentially infectious material or debris. And the type of exposure. Was it a percutaneous exposure? We'll also need to document information about how the accident happened and what could have been done differently to prevent the accident from having happened in the first place. That's part of the accident investigation process that OSHA requires us to perform. The next step is to evaluate the exposure source. That means the patient. The patient may have hepatitis or HIV. So the first place to look is at the patient's health history to see if the patient has given us information about their health status. On the health history form, generally there's a place to enter information when a patient joins your practice about being diagnosed with hepatitis or HIV. But we can't always rely on the health history. If that information is not given, it might be because the patient declined to provide that information when they first join your practice, or they may not have been diagnosed with hepatitis or HIV. Sometimes patients are worried that they might be discriminated against if they share the fact that they have hepatitis or HIV with a new dental practice that they're joining. In 2008, there was a study that was conducted in Southern California at UCLA at the Williams Institute. The Williams Institute had hired telephone research agents to contact 612 dental practices in the greater Los Angeles area at random. And the researchers pretended to be a new patient, calling to find out if a dental practice was taking new patients and then asking a series of questions. Questions like, do you take my insurance? Are you open in the evenings or on weekends? They asked questions like, where did the dentist attend dental school? And what year did the dentist graduate? When the patient or the researcher determined that the office was taking new patients, the final question they asked was, I'm HIV positive. Will you still take me as a new patient? You might be surprised that of the 612 offices that were contacted, 5% of those offices stated that they had a blanket policy of refusing to treat patients who were living with HIV or AIDS. Another 5% said that they would accept the patient living with HIV or AIDS, but they would treat them differently, and differently in ways that violated the law. 90% of those dental practices said that they welcomed patients who were living with HIV or AIDS and that they had appropriate infection control precautions in place, that they trained their team well on bloodborne pathogens, and that they followed standard precautions. So not only was the team safe, but the patients themselves would be safe from patient-to-patient infection transmission. So the first place we look is the health history to determine whether the patient has indicated that they have hepatitis or HIV. If there's no indication, the patient must be asked if they know their status. I know it's not an easy question to ask a patient. So here's what it might sound like. Mrs. Jones, my assistant Leslie just got stuck with an instrument that had some of your blood on it. We follow all OSHA regulations here, and in order to prevent infection transmission, we're required to ask some questions of you to determine whether you may have anything in your blood that could cause infection for Leslie. First, Mrs. Jones, have you ever been diagnosed with hepatitis or HIV? Now, if Mrs. Jones says no, that she's never been diagnosed, the next question would be, Mrs. Jones, would you be willing to have a blood test to determine again if there's anything in your blood that could cause infection for Leslie? We will provide the testing at a healthcare facility nearby our office. It's at no charge to you. And by the way, Mrs. Jones, the results of the testing are not revealed to me. They're only revealed to you and to Leslie if there's something she needs to know about anything that could cause infection transmission for her. This way she can determine whether she needs to take medication to prevent infection transmission. Now again, this healthcare facility is just a few blocks away. We can call over there right now and make arrangements for you to have the blood test. And then you can return right back here to the practice and we'll finish the procedure that we started today. Would that be okay? Now, Mrs. Jones can say yes or Mrs. Jones can say no. Now, some states do require the patient to agree to blood testing, so you'll need to check with your own state OSHA plan to determine. I know, for example, in South Carolina, if the patient declines a blood test, then a warrant will be issued for their blood. So the Public Health Department does have the authority. You can check with the Public Health Department or with OSHA to determine in your state what the requirements are for the patient. If you're in a state where the patient is not required to have a blood test, if the patient declines the blood test, then the employee would be referred to the healthcare provider, of course, as soon as possible. Now let's talk about as soon as possible. The employee must immediately report an accident or an exposure incident. Waiting till the end of the appointment, waiting till the end of the day, waiting till the end of the week is not acceptable. Team members must be notified that they are required to report accidents or injuries immediately to the employer. In fact, tell everyone in your practice that they're not going to be fired for having an accident or an injury. But if you do hide the fact that you had an accident or an injury or an exposure incident from us, that could be grounds for termination. We want to initiate the emergency action plan and expedite first aid and a medical evaluation. Every dental practice needs to have rapid access to a healthcare provider to evaluate the incident. Have you selected a healthcare facility nearby your office where you can send your employees, a facility that will follow the U.S. Public Health Department guidelines for exposure incidents? If you haven't, may I suggest that you do that immediately. It's an OSHA violation not to have a healthcare provider selected in advance of an exposure incident. Now, as far as soon as possible, again, we want to expedite medical care to the exposed employee because certain post-exposure prophylaxis or medications that might be initiated are more effective if they're administered to the exposed employee promptly rather than several hours later, several days later, or weeks later. Once you've determined what healthcare provider you'll choose, I recommend that you put that name on your letterhead with the address and turn-by-turn directions from your parking lot of your facility directly to the location of the healthcare provider. I also recommend that you select an outpatient occupational facility that can handle work-related injuries. If there are no outpatient occupational centers near your practice, a hospital is a good second bet. Now, hospitals sometimes can be busy places, and they may diminish the importance of an exposure incident from a dental office. They can also have long wait times if they have other patients who they've triaged to be more critical than the exposed employee. So an outpatient occupational center is an ideal location with hospitals as a backup or a second location in the event that there are no facilities that are smaller, closer to you. Also, in the event that the outpatient occupational center is closed during the hours that the exposure incident occurs. Employees need to take certain documentation with them to the healthcare provider. And first of all, they need to take a copy of the Bloodborne Pathogen Standard. Next is an accidental bodily fluid form. You can find those forms in your OSHA manual. Then any medical records about the employee, for example, hepatitis B vaccination status, and any information about the source individual. If they have indicated that they have hepatitis B, hepatitis C, or HIV, that status is also reported to the healthcare provider. The accidental bodily fluid form is a form that documents what happened, how it happened, what time it happened, what device was involved in the accident, and it also has a little place on the form where you can fill out a little accident report indicating what the employee would do to prevent that accident from happening in the future. So let's review the exposure incident protocol. First date is first, medical evaluation. Then after the medical evaluation, the healthcare provider is going to return a written report back to the employer. The employer will return that report to the employee within 15 days of receiving the report. And remember that all testing results are confidential for the patient's blood test and for the employee. We'll need to make certain that these events are documented on the medical record keeping form, and also if your state requires a sharps injury log, if the incident involved a sharp item, that is documented on the sharps injury. Well, moving on past the exposure incident, let's talk about engineering controls. OSHA requires dental practices to seek safer sharps devices to prevent accidents from happening in the first place. Unfortunately, the safer sharps devices that are available in the marketplace for dentistry are not well loved by the dental community. For example, the safety syringe. It's a plastic syringe that can be disposed of after each patient. And the needle doesn't need to be removed from the syringe because the whole entire device can be disconnected from the handle and placed in the sharps container. It also has a tube that covers the needle so the needle doesn't have to be recapped. Other types of engineering controls or engineered sharps with sharps injury protection include disposable scalpels. A disposable scalpel blade doesn't need to be removed from a disposable scalpel, whereas a reusable scalpel, the blade needs to be removed from the handle in order for the handle to be reprocessed. There's other types of caps that can be attached to a regular syringe that are, again, not well loved in the dental community. OSHA doesn't require us to use safer sharp devices if we have evaluated the devices and determined that there's a reason that we won't use them. We need to document the evaluation and document our reason for not using the safety sharps. There's also needle recapping devices. Several different brands are available on the market, and these are well accepted in the dental community. And when we don't use the needle recapping devices, we must employ a one-handed scoop technique. Remember, even using a one-handed scoop technique does not excuse a dental practice from conducting a sharps evaluation. Not only is it required, but documentation of conducting the evaluation is required, And OSHA requires the clinical team members, either those who give injections or those who break down syringes after patient treatment has been provided, to be part of the evaluation committee. You can find sharp screening forms in your OSHA manual or on the CDC website. Remember, evaluate safer sharps devices as they become available on the market. If you like them, use them. If you don't like them, document your reason why you don't use them, and keep that documentation with your OSHA manual. In the event you ever have an OSHA investigation, you can provide documentation as to why you don't use the safer sharps devices that are available. The risk of contracting hepatitis or HIV from a needle, stick, or cut, well, hepatitis B, the risk is all the way up to 30%. That's why OSHA mandates clinical employees to be offered the hepatitis B vaccination free of charge within 10 days of initial employment. Hepatitis B is a vaccine-preventable bloodborne pathogen. The chance of getting hepatitis C as a result of a needle, stick, or instrument poke is 1 to 2%. So the rate has dropped quite a bit. However, more patients have hepatitis C than we initially thought. HIV is not easily transmitted in a dental setting, and the rate or the chance of getting HIV as a result of a needle, stick, or a cut drops all the way down to 0.03%. According to a table that has been kept by CDC from 1985 to 2013, dental healthcare workers have never been infected with HIV as a result of a needle, stick, or a cut. Nurses, laboratory technicians, and physicians have experienced transmission of infection from patient to healthcare worker as a result of a needle, stick, or instrument poke from a patient who was HIV positive. But in dentistry, there's not been one confirmed case of transmission of HIV from a patient to a dental worker as a result of a needle, stick, or poke from an infected individual. I'd still like you to think very carefully about how you recap a syringe. Remember, needle stick incidents happen as a result of recapping needles with a two-handed technique. So, OSHA requires us to use a one-handed scoop technique or a needle recapping device or a safety syringe. When you recap a needle with a one-handed scoop technique, do you use your other hand to secure the cap of the needle? I suggest that you don't use your other hand, that you do a one-handed scoop technique as demonstrated on the slides. Use one hand to scoop up the cap of the needle. Once the cap is covering the needle, instead of lifting up the syringe with the cap toward the ceiling and reaching around with your other hand to secure it, simply tilt the syringe with the cap down toward the surface and secure the cap that way. That's a true one-handed scoop technique. You could literally have one hand tied behind your back and recap a needle. If you get poked with a needle, it's an exposure incident, and you must follow the exposure incident protocol to prevent transmission of infection from happening. A one-handed scoop technique is altering the manner in which a task is performed. That's called a work practice control. Recapping needles with a two-handed technique is prohibited. However, needle stick incidents are the highest workers' compensation claim according to TDIC, the dentist insurance company. So we're still, unfortunately, recapping needles improperly. I like to use a device such as a needle holder or a cotton plier to hold the cap of the syringe while I recap it and to remove the needle from the syringe after treatment has taken place. I simply get a hold of the needle with the needle holder and then unscrew it from the syringe and transport it to the sharps container. Speaking of sharps containers, replace your sharps container when it reaches the full line. Now, the full line isn't the top of the container. Generally, it's located about 3/4 of the way up the container. Never overfill a sharps container. That's an OSHA violation. And sharps containers should be located as close as feasible to the immediate area of use for disposable sharps. In some states, you're required to keep the sharps container in the treatment room. It's a good idea to have that sharps container in the treatment room because there's less chance of an accident happening if a disposable contaminated sharp is transported to another part of your office. Again, honor the fill line. Keep an eye on that fill line. Once the sharps have reached that fill line, it's important to cap off the container and either send it out, mail it away, or dispose of it appropriately, depending on the regulations in your state. A dentist in Beverly, Massachusetts, required his dental assistants to remove the caps from all needles before they placed the needles in the sharps container. He claimed that the plastic covering was taking up too much room in the sharps container. The dental assistants were very unhappy with this requirement because they felt they were exposing themselves to the dangerous part of a needle. But they worked for him and they did as he said. One of the dental assistants reported this unsafe condition to OSHA, and OSHA visited the dental practice, found the violation was a dangerous, serious violation, and fined the dentist $11,000. The dentist turned around and fired his dental assistant for reporting to OSHA this unsafe condition. The dental assistant went back to court, and a federal judge ordered the dentist to pay $85,000 in whistleblower protection and other damages to the dental assistant. Moral of this story, you can buy a lot of sharps containers for $85,000. Moving on to the next part of bloodborne pathogen training would be personal protective attire. We're required to provide protective eyewear, surgical face mask, clinical jacket, and appropriate gloves. But do we wear the required protective attire? In this picture, there's a lot of protective attire missing. Let's see if you can figure out what's missing. If you said there were missing long sleeves, that there was no clinical jacket, no protective eyewear on the dental assistant, and there was a mask that was improperly placed, it wasn't covering the nose of the assistant, you would be right. Protective eyewear includes a face shield or safety glasses. If you wear glasses, prescription glasses, you are not protecting your eyes well enough, unless your prescription glasses have been designed with safety glass and proper side protection. If you wear loupes, it's particularly challenging, but the manufacturer of dental loupes can provide you with solid splash shields and a brow guard. OSHA requires that employers provide appropriate protective eyewear, and when accidents happen causing eye injuries, most of the time the wearer of protective eyewear was not wearing the appropriate type of eyewear. A face shield is the best type of solution for eyewear to protect someone that wears prescription glasses. Prescription glasses alone are not enough. But remember, when you wear a face shield, you're not excused from wearing a surgical face mask. The surgical face mask provides bacterial infiltration efficiency. And we've got to wear the mask correctly. It's got to cover the nose and the mouth of the wearer. Not only is protective eyewear important for the employee, but it's also important for patients to wear protective eyewear. Now, we're going to take just a little bit of a departure from OSHA because OSHA bloodborne pathogen standard doesn't protect the patient. In fact, OSHA doesn't care at all about the patient. They'll respond to a patient's complaint if a patient complains that they saw unsafe conditions for employees in a dental office, but they're not necessarily concerned about patient safety. We are concerned about patient safety. And there's a young lady named Jenn who went to the dental practice one day to have a root canal. During the procedure, the dentist dropped the syringe in her eye. Now, the needle went in her eye, but as she explained what happened, the syringe actually fell over and hit her on her brow, and that was very painful. They did not provide the patient with protective eyewear. She developed an infection in her eye, and as a result, the infection was so bad that she actually lost her eyesight and had to have her eyeball removed. I got a chance to meet Jenn in June of 2017, and she's on a mission to tell everyone who will listen that patients should be given protective eyewear, and she's on a mission to advise patients that they should ask for protective eyewear when they come to your practice and sit in the chair for dental treatment. Since we're talking about eyes and eye protection, in addition to eye protection, OSHA requires that we have an eye wash station that's working and it's accessible. It should be plumbed with cold water only and have a sign that designates its location. OSHA has an info sheet you can download from the OSHA website that provides information on maintaining the eye wash station. It's important to flush it weekly because sometimes bacteria can colonize within the water lines of an eye wash station. And in the event that happens, if someone has an accident and needs to use the eye wash station, if it hasn't been properly maintained, they might be sprayed in the eyes with bacteria that's colonized that could cause infection. So on top of having something in their eyes from an accident, they could have an infection just from the eye wash station water. Moving on to clinical jackets. Remember, a clinical jacket must be worn by employees when their skin or clothing is likely to be soiled with blood or other potentially infectious material. The clinical jacket may not be worn outside of the workplace, and it may not be laundered by employees. It must be maintained by the employer. The clinical jacket must be worn properly. In other words, it must be closed in the front. If it's opened in the front, it's not protecting the wearer. It is acceptable to launder clinical jackets on site as long as the team member, the employee, is trained on how to launder the contaminated attire so that it doesn't cause cross-contamination. In other words, wearing gloves while reaching in the laundry basket for the clinical jacket and placing it in the washing machine. If you don't launder clinical jackets on site, you might send them out to a facility, or you can take clinical jackets to an off-site facility for laundering, or you might consider using disposable scrubs. But washing clinical jackets or protective attire at home is not considered to be compliant with OSHA's Bloodborne Pathogen standard. Laundering and maintaining of the clinical attire must be conducted by the employer or provided by the employer. Moving on to gloves. There are many different types of gloves available in the market today. We have polyvinyl chloride gloves, natural rubber latex gloves, sterile surgeon's gloves, nitrile gloves, and heavy-duty utility gloves. Gloves sometimes have microperforations and pinholes, and I always recommend that when we don gloves that we check for tears and holes before we start to work on a patient. The gloves that are manufactured today for dental use as medical exam devices are governed by the Food and Drug Administration, and they're allowed to have a 2.5% defect rate, which means that out of a box of 100 gloves, 2.5 gloves are allowed to be defective. When we process instruments in the sterilization room, I recommend heavy-duty utility gloves to prevent puncture wounds. Not only do puncture wounds happen in the sterilization room, but because we're not working on a patient, sometimes we're not working slowly and efficiently with sharp contaminated items. Sometimes we're rushing, and utility gloves can prevent accidents or exposures to sharp contaminated instruments. They're not puncture proof, they're simply puncture resistant. Perhaps gloves don't fit well. You can order various different types of gloves. Perhaps there's irritation to the types of gloves that are being worn. You can order different types of gloves material from your... Well, let's review what we've discussed so far. OSHA requires that new employees receive initial OSHA training. That also includes providing medical record-keeping forms that employees fill out and offering the hepatitis B vaccination within 10 days of employment. Employers are required to maintain that documentation duration of employment plus 30 years. Bloodborne pathogen training must be conducted before an employee is placed at risk for exposure to blood or body fluid. Training must be repeated every 12 months, and employers are required to maintain documentation of that training for at least 3 years. So, we've reviewed what OSHA requires us to do. Set a date, get your OSHA manual ready, review it, conduct team training on the manual, make sure that you personalize the pages, have a discussion on safer sharps devices, evaluate safer sharps devices, have a bench test, review personal protective attire, evaluate the need for what personal protective attire is required in what circumstances. Spend the time in advance reviewing concerns and making sure that team members are part of the training. OSHA training is required. Do it, document it, maintain it for 3 years. And remember, prevention is key. My name is Leslie Canham, and I hope you've enjoyed this training session.